Welcome back to the Morning Blend. We're going to play a little numbers game today, and it all has to do with your child's teeth. So how much toothpaste is okay for toddlers? How long should older kids brush? How many times a day? What about flossing? How much juice is okay in one day?
So many questions. Well, here with all the answers is Dr. Margie Castillo, a pediatric dentist with Dental Associates, and she's got a lot of these answers for us this morning. How are you, doctor?
Yes, I'm very good. Thank you. Thank you for having me.
Yeah, nice to have you here.
You know, I think kids this time of year, they've got to get back in their school routines. They've got to make sure they're doing all those things, but they've also got to be in a really good dental hygiene routine as well, correct?
Yes. I want to emphasize the importance of a routine. The children should brush after breakfast, after a sticky or sweet snack, and most definitely they should brush and floss before bedtime. And you want to stick to this routine whether it's the summer break or whether it's the school year. That way it becomes automatic for the children, and then they know what's already expected of them.
Are there tips you can give parents to make brushing more fun?
Yes, because I believe that brushing and flossing should be an enjoyable experience. Kids love to have their own special things, so you can take them to the store with you to select their own dental products. Here we have some fun toothbrushes. This is a Batman electric toothbrush. It lights up, it spins for 2 minutes. Here's a Barbie one. Here we have special fun flossers. I tell the children it's just as important to floss as important to floss as it is to brush your teeth.
And I think sometimes you make a good point about having their own things. I think it's fine for each kid to have their own tube of toothpaste, their own toothbrush, obviously, even their own, like you have a rinse there, you know, and each, they have their own stuff that they can take care of and use, I think is great. What about being involved in brushing? Because with 3 kids, I remember feeling stress about how much I should be involved in helping them brush their teeth.
Well, definitely with the young kids, it's important for the parents to be involved. You can show them how to brush and how to floss, and let them brush and floss first to develop their manual skills, and then afterwards the parents should brush to make sure everything is done thoroughly. And remember, kids emulate their parents. They watch everything you do. They listen to everything you say. So I have kids telling me, "Oh, my dad never flosses." So you want to. My dad drinks soda all day. So you want
Tattletale.
Yeah.
Exactly. So you want to set a good example. You can brush and floss together. And then, as I said, if you have established that routine, they already know that it's expected of them.
Okay. Let's get to some of the sugar questions and things that we were sort of teasing a little bit earlier. In terms of sugar, how bad is it really for kids? I think, you know, there's those commercials out there where it's about parents saying, "Oh, well, you're going to lose those baby teeth anyway." How bad is the sugar for kids?
Well, most parents don't know that you keep your primary teeth, your baby teeth, sometimes until 11 or 12 years old. So it's important to establish healthy routine early on. And
so as it relates to sugar, that's troublesome for teeth, right?
it is. If you're constantly consuming sugar throughout the day, yes, it's not good for your teeth. It's not good for your health. People don't realize, for example, with juice boxes, they contain a lot of sugar, even though it says 100% natural juice. The American Academy of Pediatric Dentistry and the American Academy of Pediatrics recommends only 4 to 6 ounces of juice a day.
That's less than a cup of juice.
Yes, and one juice box is typically 8 ounces.
Wow.
And there are children that are drinking 2 or 3 boxes every day. And the reason we want to cut back on sugar is not only does it cause cavities, but we have seen a rise in childhood obesity, childhood diabetes, so everyone is getting on board to trying to cut back on sweets and extra calories.
When should children start seeing a dentist? How old should they be?
You can come as early as 6 months after the first tooth erupts. I like to see them as soon as the 4 front teeth erupt. The first visit is actually an important time to exchange information with the parents, especially first-time parents. A lot of them don't realize that it's important to brush an infant's teeth, for example. It's a good time to establish good dietary habits, good brushing routines. It's a good time to explain about how to prevent nursing decay, baby bottle decay. As a pediatric dentist, there's nothing sadder to me than seeing such a young child with a lot of cavities already.
Yeah.
And I have a friend whose toddler had root canal.
Oh, no.
Yes.
And that can happen.
And definitely you don't want your child's first visit to be when he already has a toothache, when there's already an abscess, for example.
Well, and I think that first visit, for me at least, with each one of my kids, was a great way to kind of introduce the dentist as a friendly person, to take a look at their office, see what it feels like to sit in the chair, see what it feels like to have somebody else that you don't know brushing your teeth or helping you get them clean. And I think it's important too, you know, you keep talking about being a pediatric dentist. Because there are people who specialize in pediatrics when it comes to dentistry, it's great time, it's a great person to see when you have kids because they specialize in that.
Absolutely. It's an additional 2 to 3 years of training, and children are not static. They're constantly changing and developing, and so we have that additional training to make sure that they're developing and growing properly.
It's wonderful.
And typically, excuse me, the staff, especially at our office, they're in pediatrics because they love children.
Yeah,
they're very patient. They make it a fun experience because, you know, you want the kids to come in smiling. You definitely want them to leave smiling also.
That's great. And I know you are at the Franklin and Sturtevant Clinics, and people can find a dental associate's office close to you. You can ask specifically about a pediatric dentist. To find a location near you, visit this website. It's dentalassociates.com. Pleasure to have you.
Thanks, Doctor.
Thank you so much.
Thank you so much.